Hey, future pharmacists, ever wonder how your body handles medication from start to finish? Today we're breaking down pharmacokinetics. That's absorption, distribution, metabolism, and elimination, or just ADME. Let's go. First up, absorption. This is how a drug moves from the site of administration into the bloodstream. For most oral drugs, that journey starts in the stomach or intestines. There are different ways drugs get absorbed. Passive diffusion, the most common, where drugs move from high to low concentration. Facilitated diffusion, through protein carriers. Active transport, energy dependent, often for nutrients and some drugs. Endocytosis, for larger molecules like insulin. Bioavailability. Not all drugs reach circulation though. That's where bioavailability comes in. It tells you the fraction of the dose that enters the bloodstream unchanged. We measure it using the area under the curve, or AUC. IV drugs have 100% bioavailability, but oral drugs lose some to enzymes and first pass metabolism in the liver. Next, distribution. Once in the blood, drugs spread to tissues. Factors that affect distribution include lipophilicity, lipid-soluble drugs easily cross membranes, and reach fatty tissues or the brain. Blood flow. Highly perfused organs like the liver and brain receive drugs faster. Capillary permeability. Some tissues, like the brain, have tight junctions. Others, like liver, are more porous. Plasma protein binding. Drugs bound to albumin can't leave the blood. Tissue binding. Drugs can get stored in fat or muscle. Volume of distribution. A mathematical value that shows how widely a drug spreads in the body. High VD is equal to more tissue storage. Metabolism is how the body chemically alters the drug, mostly in the liver. This helps prepare the drug for elimination. There are two phases of metabolism. Phase 1, functionalization. Reactions like oxidation, reduction, and hydrolysis, often via cytochrome P450 enzymes. These can activate or inactivate drugs. For example, codeine, morphine. Phase 2, conjugation. The drug, or phase 1 product, is joined with molecules like glucuronic acid or sulfate to make it water-soluble for excretion. For example, morphine to morphine glucuronide. Now let's talk elimination. How the body removes the drug, mostly through the kidneys, urine, or liver, through bile and feces. First order versus zero order kinetics. Most drugs follow first order kinetics. A constant percentage is cleared per unit time. But drugs like phenytoin or ethanol follow zero order kinetics, clearing a fixed amount per time, risking toxicity at high doses. Half-life, T1.5. Half-life is the time it takes for the drug concentration to fall by 50%. It's key for determining how often to dose a drug. Steady state and loading dose. After repeated doses, the drug reaches a steady state, where the rate of input equals the rate of elimination. This usually takes 4 to 5 half-lives. To reach steady state faster, we can use a loading dose. Loading dose is equal to VD into target concentration by bioavailability, that's F. So to wrap up, absorption gets the drug into the blood, distribution spreads it through the body, metabolism modifies it for safety or activity, and elimination clears it from the system. If you found this breakdown helpful, like, subscribe, and share it with your classmates. Got questions? Drop them in the comments. Let's keep learning together.